month, because you've had a lot of sessions. I think today is actually at the tail end of the webinar series that you've been having, where you have actually been taken through a number of topics. So what we'll talk about today is the community power against antimicrobial resistance, effective engagement strategies in the community. So as I said, this is quite an interesting topic, because the community, you agree with me, that is very important when we are looking at matters antimicrobial resistance. So as a brief outline of the presentation, I'll first start by just shedding light on what REACT Africa is, and also the importance of addressing this global health threat of AMR. Then I'll move on to the importance of community involvement, and then look at the main topic of today of what the effective community engagement strategies we can actually come up with. And then I'll also shed light on some case studies and some success stories that have actually worked across different parts of the world, and also look at the potential impact of youth champions in the fight against AMR, and with a call to action. So REACT is Action on Antibiotic Resistance. We are a global network. Our main office is in Uppsala in Sweden, and we are also represented in Latin America and also in REACT Asia Pacific region. Here in REACT Africa, our secretariat is in Lusaka, Zambia. And we are working towards a vision to have a world that's free from untreatable infections. As you know, AMR has really impacted on our medicines, which were able to treat some infections, are actually being rendered ineffective due to antimicrobial resistance. And the mission that we have as an organization is to enable collective action that ensures sustainable and effective, that ensures sustainable and equitable access to effective antibiotics for all. Because for example, low and medium income countries like in Africa, where we are now, we recognize that there are issues to do with actually accessing the antibiotics themselves. The antimicrobials are not accessible, and we would want to ensure that there is access to these quality assured and effective antibiotics by all. And it was actually initiated, REACT, as a global network in 2005 to be a global catalyst, advocating and stimulating for change in matters antibiotic resistance. So we're actually one of the first networks to be set up to solely look at this global health threat of antibiotic resistance. And what makes us unique as REACT Africa and REACT as a global network as well is that, first of all, we are a think tank. We provide advice, technical guidance to as a way of being a think tank around matters antibiotic resistance. And we use this by providing, as I say, technical assistance, advice, ideas, because we actually have a body of experts in our network. We are also a policy accelerator, where we look at advocating for policy reform, advocating for translating policy into practice. We are also keen on research. We are a research organization cutting across the different sectors. And in addition, we also implement a number of AMR initiatives. Looking specifically at REACT Africa, our main mandate is actually to support countries in developing and implementing their national action plans on AMR. I'm sure you have talked about this even in the previous sessions, that after the recognition that indeed AMR had become a global health threat, the Global Action Plan was actually instituted in 2015. And from there, countries were mandated to come up with their national action plans on antimicrobial resistance, which quite a number now. It's encouraging to note that most of the African countries do have national action plans now. So REACT Africa, we work very closely with a number of African countries to actually support that process of revising. Now that most of them, because these were 5-year plans, so most of them are actually coming to an end, and there have been, of course, a lot of challenges around implementing those national action plans, because on paper it looks good with the 5 objectives that are in sync with what the global action plan had. But then coming up to implementation, a lot of challenges have been seen, especially in the African region. So we do use both bottom-up and top-down approach in the way we work, where we actually work right from the national level. In the levels that we work, one thing that makes us unique as React is that we work with a diverse range of stakeholders at various levels. We work right from the community level, which today we are going to be focusing on a lot, the sub-national level, national level, regional level, and also at the global level. So we actually work with a diverse range of stakeholders across also all the different sectors, the human health, agriculture, environment, food sector. And we also do a lot of advocacy, especially as React Africa, so that in the global agenda, the unique challenges of the global south, the low and medium income countries, the African region are actually brought to light. This slide, I will not dwell much on it, but it's just to, because I know you have been for sure discussing that AMR is indeed a global health threat. The data that came out from this GRAM report that was released in 2021 really showed that AMR is indeed a global health threat. If you look at the statistics that are showing in the slides that is before us, yes.
I'm sorry for cutting you short. I think we cannot see the next slide. I think we are still on the first slide.
Oh, wow. So am I supposed to share my window, Zachariah, or my whole screen? Because now the slides are moving from my end. Let me stop sharing and then try and share again, if that would help. All right. Because from my end, they are moving. So let me try.
Things I've noticed over time with Google.
Sorry?
One of the things I've noticed over time with Google Meet is that sometimes you might want to share your slides, and when you put it at the slide share, it will be moving at your end, but it will not move from this slide, from our own view. So you can go back to your and don't put it in slideshow. Just let it be like this, and you can continue like this if you can see it like this. Not necessarily putting it in the slideshow mode.
Ah, okay. Because if I put in slideshow,
then you might not. Yes.
Okay. Oh. All right. That's fine. So now, which slide do you see? Do you see the one that says global context, AMR burden?
Yes.
Great. So anyway, I think the rest of the slides are fine, because I'll also share this presentation so you can go through the rest now of the slides that I had talked about. But anyway, it was just to do with the background around what React Africa stands for, the work that we do. So now you'll notice that sub-Saharan Africa faces the highest burden of AMR, as the statistics that came out of this report show. And the more reason why we actually need to leverage on this and make sure that as the upcoming leaders, we are at least working towards ensuring that we mitigate this global health threat. So in my next slide, I wanted to pause and just hear if there's anyone who would want to let me know what a community is from the audience. Unfortunately, as I said, Google Meet, I can't see the participants, but it's fine. So Zachariah, if there's anyone who's either putting something in the chat of what a community is, or if someone has their hand up, you'd help me with that, because I don't see anyone from my end.
Okay. Please, if you have like an answer to what a community is, please, you can either use the raise hand button, or you can type your message in the chat box that I get to have, or call you up if you want to give an answer to that. Thank you very much. So we have,
Yes. Um,
okay, I think we have a comment from Daniel saying that you can try sharing with the book format if it will show in the slide. It will show in the slide share mode.
sorry. If I share what? Sorry, I didn't get that.
Daniel was saying in the chat box that you can try sharing with the book format. It will show in the slide share mode. So there's this book format at
This one. Ah, all right.
yes.
Perfect. This one, right? Okay, great. Yeah, thanks for that. Now at least I have learned something about Google Meet.
So
Yeah, because so do we have anyone who's defining community for us?
yes, we have Faith. Faith defines community as a group of people with same interests.
Great. Yeah, thanks a lot, Faith. Indeed, community is very diverse. Do we have another comment? If
Let me check.
not, all
So
right.
you
So,
can use the raise of hand button. If you have another person that wants to share, you can
all
raise
right.
up your hand.
No, that's fine, Zakaria. What I just wanted to bring out is that it can be defined in so many forms because the community is really diverse. It's really large. That's why it's even more complicated when you are dealing with a multifaceted problem like AMR and you are trying to engage the community. And indeed, Faith is very right that community is a group of people who share common characteristics, interests, or goals, and who interact with one another. They can range in size from very small groups to large populations, actually, and be still called a community. They can be local, national, or global in scope. Like now, looking at even COVID introduced us to a different format of community where the virtual means has now been amplified. We now can be able to communicate, share different interests and goals across different regions of the globe, essentially using digital means and not necessarily meeting physically. So communities can be based on various factors such as the location, ethnicity, religion, interests, hobbies, or professions. And most importantly is communities come together to solve problems, celebrate achievements, and provide mutual support. So it is important in a problem that is like AMR to target this very essential co- group, which are the communities, the different communities. And because they are very helpful, that's why I even highlighted that they are helpful when we are trying to solve problems, because this multifaceted problem cannot be done by one stakeholder, as you can imagine, because it actually needs a lot of people joining hands to ensure that we mitigate this. So I've just put to your right here the examples of some community groups that are relevant in AMR work. People like the community health workers, very important when we are looking at engaging communities, because they're actually the gatekeepers of the communities who actually help to bridge the gap between implementers, policymakers, and the community themselves. There are people like the elderly population that are sometimes forgotten, and sometimes they are actually also very key in actually transmitting some of these infections. Mothers and caregivers, of course, mothers being the family, the ones, the gateway to the family, important when we are targeting the communities, both in the rural communities, urban communities, traditional healers and herbalists, very important, especially in our context here in Africa, where there's a lot of faith healing that takes place. There's a lot of sometimes people do not do not go to the health facilities, but instead seek these traditional leaders, the herbalists. So very important to target them when we are looking at community groups that are relevant in AMR. Farmers, very key as well in the agricultural sector, as they actually contribute a great deal to the misuse and overuse of antimicrobials. Patient advocacy groups, for example, patients like the ones living with HIV, also a very key group. Students, youth-led organizations like yourselves, a very, very key community stakeholder group to target, church groups and schools as well. So this slide, I hope my slides are moving, Zakaria.
Yes, they are moving.
You see the drivers of AMR?
Yes, I can.
Great. So we know these drivers of AMR. What causes AMR? This one that was done in back in 2016. This graph is just showing us some of the drivers of AMR from a research that was done, looking at the factors that actually drive the the escalation of this global health threat. If you look at it, you realize that human antimicrobial misuse and overuse, and also animal antimicrobial misuse and overuse are actually the greatest, because this is color coded, as you can see up here, that the human antimicrobial use, if you look at it here, and also the lighter pink color here, that also shows the animal antimicrobial misuse and overuse. And of course, the other contributions are here, including the environmental sector that shows in green. So you realize that human behavior, in other words, communities, because communities, humans are the ones that constitute these communities. We are the ones that are actually responsible for driving this global health threat of AMR. So you'll notice that the biggest circles in this graph that's shown before you actually depict that human antimicrobial misuse and overuse is where the problem is. And it is us as human beings that are driving this. Hence, it is important that we have effective strategies when we are targeting the communities. So what are some of the challenges that are there when we are trying to look at the community engagement in AMR mitigation? It is important that we realize and recognize these challenges. Reason being, it will then inform us in terms of the strategies, because if we don't know what the challenges are, then coming up with the strategies is a problem. You'll agree with me that there is actually limited awareness and education around AMR, especially in our context here in Africa. And this can actually hinder now trying to come up with these strategies to engage the communities. A lot of studies have been done. A lot of studies have been published that actually speak to the fact that communities do not know what antimicrobial resistance is. Here in Kenya, where there's a certain group that tried to look good to communities, talk about antimicrobial resistance using the format of using like radio stations to try and have people listen in. They share their views around what they think about antimicrobial resistance. But a very big number, greatest percentage, did not even know what the term means. Uh, Relating to the term antimicrobial resistance is very difficult. And then the fact that we sometimes say antibiotic resistance when we are just looking at the antibiotics. And then, of course, when we then broaden it to antimicrobial resistance, it is a very technical term for the communities. So the challenge that is there is we need to ensure that people are made aware. I was talking of this listening program. What they realized is because people did not know what AMR was, they now started asking different questions during the listening programs for the radio. In fact, most of the questions were around maternal and child health issues, HIV and AIDS, because that's what communities relate to. So when they just saw that there is some health professionals coming to talk about a health challenge, they, of course, the mothers, the caregivers diverted to asking about what is happening with their maternal and child health issues, what is happening around their HIV/AIDS issues. So we really need to change that, because the interventions that come to the community, you realize that there is very limited awareness and knowledge around this problem. So there's limited access to healthcare services in our context, and you realize that communities may not receive the correct diagnosis and correct treatment. They might even not be able to access the healthcare facilities because, of course, of the challenges that we face in our region, where just being accessible to these facilities, when you go there, do they have the medicines available? key challenge, not there. Do they have the trained healthcare professionals available to attend to them? Key challenge. Do they have the diagnostics that are required for them to be treated in a manner that what we are trying to speak to prevent the misuse and overuse of these antimicrobials? Key challenge again. So this is one of the challenges of limited access to healthcare services. Poor infrastructure and resources. There are, of course, a lot of conflicting healthcare challenges in the African continent, where now, how does AMR now get the attention that it deserves in the different conflicts of conflicting healthcare challenges? You can imagine during even COVID-19 that focus then was essentially on COVID-19. The rest of all these other, now looking at AMR, which people do not even relate to, which does not have a face, unlike such other diseases such as HIV and AIDS, it is very difficult now for it to have attention even in matters regarding resource allocation. Cultural and behavioral factors, a very key one. I did mention the traditional healers when I talked about some of the stakeholder groups that are relevant in the community. So you'll notice that some of these cultural beliefs and practices and behaviors also impact on community engagement in AMR, including the use of traditional medicine, beliefs about illness causation. Sometimes people just thinking this is caused by something else and not trying to seek the professional advice, and faith healing issues as well. Looking at this also, herbalists, they've been now known to be using also the antibiotics when they are preparing those concoctions that they actually give the communities. So people now end up again misusing these antibiotics as they just take them and put them in these concoctions that they'll be coming up with. Lack of regulatory frameworks. So if you look at, especially in our context here in Africa, there is really, really a great challenge. And you'll agree with me, even in your setting, that regulation is very, very, there are a lot of gaps in regulation, meaning that number one, prescribing is not even done in terms of making sure if at the local pharmacists, if the pharmacies or just the informal, even in the streets, you realize that antibiotics, you can actually see them being sold without even any prescription. There is also the issue of the counterfeit medicines that are there without anyone then making sure that whatever is in the market has passed at least the quality standards. Have the suppliers also been accredited? All those issues are really a challenge because they do affect issues around dealing with the community as well. There's also limited research and data available, so which makes it very difficult now to actually know the AMR prevalence and the patterns in many of the African countries. And this can actually impede community engagement efforts. Without accurate data, it will be actually very challenging to tailor the interventions to address the challenges that are faced at the community level, because it will be important to know what the data is saying, which, for example, what antimicrobials are being used in a certain, say, community. What is the reason? What are the key health conditions that are seen in that particular setting? And without that such data available, it then becomes very difficult to come up with appropriate, sustainable, and targeted interventions. So addressing challenges in community engagement, it actually requires a multifaceted approach that involves raising awareness in AMR, improving the access to healthcare services, because the challenge with raising awareness and then people are now aware, we agree, but what then happens to a community that cannot access the health care facilities? Because we have told them, we are trying to sensitize them, but as we sensitize them, they will not be able to say, access and do the good practices we have just told them, that you are not supposed to just self-prescribe. You're supposed to make sure before, when you're unwell, you go to the health facility. Are they going to be able to do that? So that becomes already a challenge there. So those are the issues that we have to look at. Of course, I talked about the cultural factors and also strengthening those regulatory frameworks. So for any intervention, for us to have meaningful results, for us to have meaningful change, for us to have meaningful impact, the first thing we have to do is to understand the target community group. We have to understand what challenges we are facing. I talked about the fact that data is a challenge in Africa, but in as much as it is a challenge, we should try, even in our local context, to understand what the problem is before we come up with the interventions. So assessing the knowledge and awareness levels is important, just to gauge the current knowledge and awareness of AMR, because there might be an assumption sometimes to think in the technical circles, or maybe in some of the institutions where you repeatedly talk about AMR, you can assume now when we are going to the communities, we'll just start by saying this, and yet the knowledge level is very, very low, such that you have to actually come down and see how to make that message relatable. How do we communicate AMR, for example, in a vernacular language, in a local language? It has been a challenge in every African country, actually, because for people to come up with what are we saying when we are communicating AMR is very difficult. Um, Identifying the cultural and behavioral factors is key. When we are going to look at the, for example, antibiotic use that I have talked about, it should not be assumed, because some communities will actually have higher incidence of this use of, or going to the herbalists and all. So before going through any interventions, it is important to actually understand the target community group. And I talked about this, the access to healthcare services. This slide is just summarizing what I was talking about in terms of some of the challenges, and now going in now to try and have some strategies to engage communities. We should start by looking at assessing what is on the ground. Is there access and availability and accessibility of healthcare services? Are the healthcare services accessible? Are the medicines available, the essential medicines that a community needs? Are they there? Do they have the diagnostic tools for the infections? The current practices that are there, it will be important to also evaluate the current practices within the communities, including the patterns of the use, the sources of the antibiotics. What are the main sources of these antibiotics for the human health sector? Are they pharmacies? How many are they? Is it health facilities? When we look at the agricultural sector, uh, are any agrovets accessible? What happens when people have their animals unwell? Who is the one that are tending to these? Are there any trained veterinarians in the area? What are the common practices? Are antibiotics used for growth promotion in this particular community? Because without the knowledge of all these factors, it will be very difficult to then come up with tailored strategies to engage that community, because you'll notice some people still use like traditional means in maybe rearing the animals. In some communities, antibiotics are now used so much in growth promotion. So it is important to know what the real challenges are according to the context. Identifying the key stakeholders, very important. Who are the opinion leaders in that community? Who are the healthcare providers, the educators, the local organizations? Where do these communities gather? Are there church groups that are there that can be influential and a key entry point to the community? Who are the maybe district administrators in the political arena? Are they chiefs that people have some respect for. Who are your key stakeholders that if you want any meaningful change to happen in the communities, who are you targeting? So a good stakeholder analysis is very, very key at the start so that none of the key stakeholders are left out in the interventions that will be done. Because you can imagine if you leave a key stakeholder, it then means they can either, when the intervention is going on or you're trying to engage the community, they can actually have influence and power to actually make sure that either whatever initiatives or interventions you're doing are put to a halt, or either the community will not listen to you as long as you do not have backing of a powerful opinion leader. So it is important to actually come up with a good stakeholder analysis based on the actual context. And communication channels in the community, important to assess as well, because when you get into a community, it is important to understand what makes sense in reaching that community. What are the literacy levels? Because if you come up with flyers that say, okay, antimicrobial resistance is really a global health threat, the Graham report said this, there's a global action plan, would that relate to a community that has very low literacy level? Indeed, no, because they'll actually wonder what you're talking about. They will not even be able to read. Let's start from there. So it is important to know what sort of community we are looking at, what sort of communication channels work. Are they, do they prefer, like radio sometimes is actually a powerful communication channel in some of these communities, especially the rural ones in the African context. These days, of course, there is now the advent of social media with this WhatsApp. Of course, that's also relevant to people with a bit of literacy levels. So important to understand the community. If it means it's a like exposed group with so many of them with smartphones, then that can work to use such channels such as social media. If it's a community group where maybe they just gather as women, maybe during church or funerals, it is important to understand all those things so that the communication channels become relevant and useful. Mapping resources and capacities, also important to identify what are the existing resources in the communities, the infrastructure, the capacities within the community, including things like the community health workers, what's community health, in some contexts they're called volunteer, community volunteers, yes, or community health workers. So those ones, are they available? How do they operate? Do they have resources to be able to reach the communities? What is the entry point? Suppose you want to engage these ones. What has worked for other programs that were done before, maybe for HIV, AIDS, or TB, malaria, etc. So identifying the priority areas for intervention becomes a key thing at the end of now assessing now to understand the community group before we even talk about the strategies. So now it will be important. Of course, there are a lot of challenges. There are a lot of now understanding what this community is about, which channels work for them, what are the cultural practices, how accessible are their healthcare facilities. There is need to also, of course, prioritize based on this. When a needs assessment is done or a situational analysis is done, it will be important now to align the specific needs and the challenges identified within the community. And resources are always limited, so it's important to prioritize the high impact and low resource initiatives. So now I'll move over. I think we'll just take all the questions at the end if there are any, but I'll now move over to 8 effective strategies for engaging communities in AMR mitigation that I would want to take you through, based now on what we have discussed so far around understanding our communities, understanding who we are going to target, and now I'll talk about the effective strategies for engaging these communities. The first one being education and awareness campaigns. This one, very important. One of the key challenges that I've already mentioned is the low awareness levels around AMR. So indeed, there is need to develop targeted educational campaigns to raise awareness and on awareness about AMR, the importance of antibiotic use and the consequences of misuse, because it is important for the community to own the problem in a sense. Because if you are going to essentially tell them that AMR is a problem, but they do not realize that their own behavior is actually contributing to the problem. What they are doing in terms of practices, say for self-prescription, are contributing to AMR. If they are going to be pumping their chicken and their cows and their goats with antimicrobials, what are we saying? How does the food chain look like? How is that behavior at the end of the day contributing to them having longer hospital stays? What is the impact if they are going to be polluting the environment? How is that going to come back to them and haunt them? So we really have to have very good targeted educational campaigns that speak to them at the end of the day as an objective, them owning the problem that now I fully understand AMR is a problem, and I as the community member, what am I going to do? The channels, important. Will they be community workshops? Is social media going to be used in these awareness campaigns? Are radio programs going to be used to reach a wide audience? So indeed, this is a strategy that needs to be done in terms of raising awareness for the communities. So it is important that these education and awareness campaigns are very contextualized to what works for a specific community. Partnerships are very key. There is need to collaborate with local community leaders, healthcare providers, schools, religious organizations, and other stakeholders. It is important to engage so that the message is amplified across the different community members. Building partnerships also enhances credibility and the reach within the community. So one key strategy that can be used is to actually have these community partnerships. There is no way of doing it alone. And one of the key messages that is being looking at the challenges around AMR, getting the relevant resources to use ETC, has been actually around trying to see how to make sure that AMR fits into the other parallel programs, such as the HIV/AIDS that I was talking about. So partnering with other organizations, as the youth as well, if you have maybe a student who's interested in a topic that necessarily is not around AMR, for example, sexual and reproductive health, very key topic for yourselves at the moment, and you will realize that using that as a key channel to also bring in AMR around that and in targeting communities can actually be good. So you can't do it alone is the key message underlining this strategy. Partnerships, very important. Tailored messaging. The messaging that goes has to be tailored. I have said that it's difficult for people to understand this topic of antimicrobial resistance. So it is important to resonate with the different community settings, taking into account the cultural beliefs, of course. The use of simple language and visuals helps to convey complex information effectively. There are a number of resources that are available online to help. As React, we actually have a toolbox. The link is there. As I said, I'll share these slides. There are a lot of useful resources there, including even comic strips that are there that talk about engaging different community groups, right from the students. It looks at how you can engage, say, political leaders. So those comic strips and small leaflets and booklets actually segment the community into different stakeholder groups and what is the best messaging for them. So our toolbox actually has quite a diverse number of campaign materials. The quadripartite, which is the WHO, FAO, the World Organization for Animal Health, and also UNEP, have come up with a lot of campaign materials that are relevant. The ones that they promote usually during the WOW week every year, those materials are also helpful in trying to come up with what is relevant. So the idea is to look at the different community needs, look at how the messages can be tailored. Wellcome actually came up with also a good report where, of course, this was a research that targeted countries in the European region mostly, and a bit of a few, one or two countries in the low and medium income countries. So what they were trying to do is to reframe resistance. How do we talk about the problem such that people can understand it? Like instead of saying antimicrobial resistance, for example, how do we change the language to talk about that medicines are losing their effectiveness? We are not able to treat um, you because there is a problem that is happening. How do we reframe? So this, I have also put the link there. It was just looking at or talking of some of the helpful language based on the research they did anyway, which can be just a guide in trying to look at, in our context, what makes sense. What do people relate to when we want to say now these will no longer work? I remember there was a time we were back in it was Swaziland, right? Eswatini now, where they were saying they then thought because everyone would like, how do they were now using actually some of the common antibiotics to try and make people relate to what antimicrobial resistance is. So they would actually say, so you see, how long have you used this tablet? They actually take it, one common, any common antibiotic in the setting, they can take it and then actually visually say, so you see this tablet, how long have you been using it? Then they can say, since I was in primary school and whatever. Then they say, do you know it's losing? It's the way it used to treat you. It's actually losing its value because of what we are doing, trying to make it as relatable as possible. So tailored messaging according to what makes sense in that setting. So this nurse was very passionate about the fact that she was using the actual antibiotics when people come as part of a patient counseling to say, when I'm telling them you're supposed to finish your dose, because in that setting, it was her actually doing even the dispensing, not the pharmacist. So she was very keen on this method that she was using, that I take the opportunity to talk about the fact that these antimicrobials, the ones you have always trusted to make you well, very soon they will not be able to work, and you actually have to either stay longer or get more expensive medications, the second line drugs, or so that they get to relate it at the level that makes sense to them. So that's just what this tailored messaging would look like. And these resources are also very good in terms of, and a lot of them online actually. um, Discussions, always effective. Interactive workshops and training is also an effective strategy when you are engaging the community. Having workshops or training sessions or focus group discussions to engage communities in different discussions about AMR can be an effective strategy. I think you have seen that in the churches, for example, which is a key mobilizing entry point in the African context. Sometimes there are different topics that are talked about there. If there are also some opportunities, suppose for the youth in things like football tournaments and different sporting activities, these can also be used to come up with interactive workshops or training sessions of mobilizing communities to come together, discuss key challenges. That helps because if one has understood what AMR is in a discussion, the next one can also understand. It will be important to provide, to encourage participation and provide opportunities for questions and feedback in these interactive workshops and training to ensure that the communities understand what you would want them to do. Um, Community health workers, important to partner with, as I won't dwell much on this, but it's actually a key strategy that's there. In Kenya here, in our context, the government, the national government has actually recognized community health workers as a key entry point to the community. So they've actually been formally co-opted into the formal structures of the country. And that is actually a key thing, a key milestone actually in engaging communities. So it will be important to look at the context, what makes sense in your setting as well, and be able to leverage on these frontline healthcare providers in the various communities. It has worked in some of the other health challenges, and it will be important to do so. So behavior change communication, also very important. It is a strategic communication approach that aims to promote positive behavior change amongst individuals and by extension communities, because there is emphasis on individuals here, because behavior starts with a person acknowledging that they need to change their behavior, and by extension the communities. And by using targeting messages, interactive techniques, and social mobilization, we'll be able to actually change the behavior. So behavior change communication, in the context of AMR, plays a crucial role in influencing health related behaviors and also attitudes. I mentioned in the beginning that a situational analysis would be important. Things like now coming up with a knowledge, attitude, and practice survey at the start will be able to inform now behavior change communication, because you'll be able to know the knowledge levels, you'll be able to know what the attitudes of that community are towards their health, towards AMR. What are the practices for that community? So the CAP study is very important to inform this behavior change communication, which actually strategies that focus on promoting positive health behaviors related to antibiotic use, hygiene practices, and also infection prevention. And this is also very useful even in the healthcare setting, where there are challenges around antimicrobial stewardship, where sometimes prescribers, their behavior is not, where you're trying to understand why sometimes prescribers would prescribe without adhering to standard treatment guidelines, for example. Why is it that the infection prevention and control measures in the health facilities, simple things such as hand hygiene, why is it not adhered to? Why do we have behaviors that people exhibit when they know the right thing they're supposed to do? So this methodology of trying to come up with communication that is targeted as changing the behavior is very important. The use of storytelling, role playing, peer to peer learning to inspire behavior change is also very important. People relate to stories. People relate to actual, if someone tells you, I've been through this, and this relates to my situation, I think you will listen more. There have been quite a number of advocates around in at the global level, right from here in Africa, some from different parts of the world, who have been very influential in trying to drive change by sharing their stories. There is one called Vanessa Carter. Some of you might have heard of her, who was involved in a car accident in South Africa. She's actually from our region here. And she actually suffered a lot because because of the infections that were, because she had to come up, or she had some skin grafting. Her face was deformed. So as she went through all this now reconstruction of her face and all, a lot of infections came into play, where she actually now had a lot of now there was a lot of resistance to the bacteria that she had. So now what happened is she actually had to go through a lot of strong second line, third line drugs to try and help her. So when she talks about a story, how a life changed in a flash due to an accident, she found herself in hospital. She did not even know what antimicrobial resistance was. She did not know that there are some pathogens that are resistant to the common medicines that are used, but she learned that through her personal experience. And when she shares her story, it becomes now very relatable in terms of trying to change the behavior in the communities or across different stakeholders. So the use of relatable stories is very effective. So this is a strategy that can be used. Role playing as well, to try and visualize what really happens. I know you as youth, in my slides as I come to as I continue with the presentation, you realize that there are quite a number of strategies that have been used by the youth themselves. So incentives are also important when it comes to community members, including AMR awareness campaigns. If they've done any campaigns or use of antibiotic, they have been able to contribute to prevention efforts, you can actually recognize them. So community-led initiatives also, where you're actually having the communities themselves empowered and being the ones leading some of these interventions is also important. Monitoring and evaluation, very important, to track what you've been doing, to track what the mechanisms that you are using in your interventions is very important. So by implementing these engagement strategies, we can effectively engage and empower communities in the fight against AMR. Some of these slides now look at the success stories, some of what we have been using. Like, for example, as React Africa, we have been able to use some innovative entry points, such as using the church group. Like the slides you see here show these women in the church uniforms where they are actually engaging. One of my colleagues here, this is in Lusaka, Zambia, where she uses a church women's group to actually raise awareness for these using the church women as an entry point. Here they are looking at some of these IEC materials that have been distributed. When looking at the youth, React Africa actually believes the youth are key and a valuable stakeholder in AMR mitigation. In Africa, 60% of the Africans' population actually is estimated to be under the age of 25. And by 2030, about 42% of the global youth will actually be 42% of the youth, the global youth will be constituted by youth from Africa. So that's a very key statistic because half of the global youth will actually come from the African continent. And we believe we are a key stakeholder group as the youth now that we are targeting today. So we actually work with youth right from the primary or elementary level, going through to the high school, the tertiary level students like yourselves in the universities or early career researchers. The reason being, youth are key change challenge. You understand the context in the communities. You are a key messenger to the messages that need to go to the parents, to the other community groups. So some of the activities we have done as React Africa include a leadership program that we set up. We also come up with what we call My Turn events, where we have youth come together, showcase, learn from each other. We also have a mentorship program, competitions that we do, community engagement projects, and we also support in research and also have youth attend different conferences. This slide just shows some of our first cohort of youth champions. Some of them were also from Nigeria that attended this. And it was good that from this program, a lot have gone ahead to do a lot of community engagement in their different settings. I talked about these My 10 events that we have, webinars where we engage different stakeholders coming to talk to the youth and just inspire them to do a lot of community engagement and different initiatives in their communities. This slide shows these students trying to use art, and it was very interesting and exciting. You'll notice the one at the far left there is actually holding a chicken. He's acting as a vet there and showing how they were just, the message that was there is trying to sensitize the community that first seek professional advice before using and misusing these antimicrobials. On the right is also some students from Uganda there. These ones are from Kenya, the ones I just showed, from Uganda, who were also using a drama skit to try and use art in sensitizing communities. A few examples also here. Use of, talked about football tournaments. Some were being creative, just writing these IEC materials to make sure the message is reached. I talked about making sure that we do have tailor-made messages relevant to the communities. We also support during the World Antimicrobial Awareness Week, a very key week to use to engage the community because there's already a lot of hype around AMR, and it would be good if to utilize such a platform where already people are talking about the antimicrobial resistance in your communities. So leveraging on such weeks really is helpful. So some of the successful community-led initiatives around AMR in the world, I'll give an example here for what our colleagues in React Asia Pacific region have done regarding using an antibiotic smart communities indicator framework. This one actually came up with 15 indicators. As I said, I'll share the slides. There's also the link there where you can just look at it. But basically, the idea behind it is to use indicators to measure how smart a community is around antimicrobial resistance and awareness. And from there, they were actually able to pilot this. And one of the states in Kerala region in India actually had an improvement in their indicator rating after they implemented initiatives. As I said, they first started with the situation analysis, did some targeted interventions, and at the end, they actually were able to confirm that these indicators are able to change with initiatives that are done when you have looked at which indicators define what a smart community is. And looking at youth as the role that you can play, since you are now the future leaders, although we don't want to call you future leaders, but just current leaders with a little bit of more time, you can be influencers who can drive positive change by engaging communities and leading the efforts to address AMR. Some of the examples of what you can do is to organize. I talked about this, so I will not spend so much time on it, but football tournaments. You can also engage your peers in the universities, looking down at also the lower levels, the high schools, the primary school. You can also look at how you can partner with them and partner with healthcare providers and organizations to also promote antibiotic stewardship practices. This is something that can be done. Most of the youth champions actually who are interested in an AMR are actually medical students. So you can also look at how you can partner with health facilities. How do you also engage the students that are from non-medical faculties? Because very essential. Students like, for example, doing communication are important because we said we want messaging that relates to them. And the use of social media, podcasts, digital platforms, which I know you guys are very keen and very innovative around using, are also very important. So use of these innovative and also modern use of communicating and engaging the communities in a large way using such digital platforms becomes important. There are benefits in youth engagement because it actually empowers the young people to become advocates for public health issues. It fosters a sense of relationship, responsibility, sorry, and active citizenship among the youth. Because if you are able to bring about change through like the initiative that's actually happening today, where we have a youth-led initiative where champions come together to say, how do we sensitize our peers in a webinar series? This is one of the examples that are actually good. And it actually gives a sense of responsibility as well. And it strengthens community resilience when we look at now dwelling down to the agents of change that I talked to about. So as a call to action, as I come to the end of my presentation, I know I started a few minutes past the time, but it is important to remember that by 2030, young Africans are expected to constitute close to half of the global youth and account for 75% of those under the age of 35 in Africa. It is important that we know that the responsibility for change lies with us because we are actually a key stakeholder group if we look at these demographic statistics. It's important to join hands with fellow youth to raise awareness, not only in your country, but even across Africa, even moving over to even different regions of the world. And it is important to be the change that you want to see in taking actions in your community. And together, really, we can make a difference in the fight against AMR. So we do have a report that came out published by our colleagues in React Europe, where I think my colleague Daniel, who's even on the call, contributed to this, where we actually came up with now a way forward of what we think would make sense when we are engaging communities. I talked about most of these things, but a clearer, relatable narrative is very important for community engagement and for us to have meaningful change. The effective strategies that I summarized, I gave you those 8, are important if we need to have change in our communities. Embedding a One Health approach, very important. AMR cuts across human health, animal health, environment sectors. And it is also important to integrate AMR, I talked about it, into other programs so that at least we can be able to utilize the resources in a more efficient and effective way, and foster both top-down and bottom-up approaches where we can have the community-led initiatives. At the same time, we also have the top-down approach where we are focusing on what is in our national action plan, how are the political leaders informing what is happening at the lower levels. This year, we do have the political declaration coming up at the UNGA high-level meeting, the UN General Assembly high-level meeting in September 2024. I'm sure you touched on it in one of the sessions that were there, because we are trying to look at how now can we influence change. How do we change the last political declaration that was done in 2016 and ensure that it is more reflective of, for example, the unique needs of the African region. This includes also fair representation in governance structures and decision-making processes as well, right at that global level. So in conclusion, youth engagement, because I know the target audience for today are actually the youth. We were focusing on the community engagement strategies, but how you as the youth are actually key in combating AMR. It needs us to work together to create a healthier and more sustainable world for all by using effective, innovative, and sustainable strategies that I also tried to summarize in this short time that I was given. So I personally believe that the strength of the youth represents a shared asset for Africa, and not only for Africa, but for the global community. And you as the young individual, you embody our history, our present moment, and also our future. And there is no other demographic group that can rival the optimism that you guys have, the energy, the creativity, the bravery that you have been exhibited by the youth. And I have personally witnessed this unmatched potential from you. As I said at the beginning, it speaks volumes when I see you creating time to join such sessions, to listen to different speakers, just shedding some light around matters antimicrobial resistance. So indeed, I do not doubt that you've got a lot of potential, you've got a lot of energy, you've got a lot of passion in this work, and continue with the efforts that you're doing. I'll end here, Zakaria. I know I have gone a bit past time, but as I said, I think we started some minutes late. So I'll stop sharing my screen. I don't know whether there's still time for some questions. If not, then I can just answer them via the chat. Thank you so much, and back to you.
Okay, thank you very, very much, Julian.